Thank you
Okay.
so much for joining us this evening. My name is Michelle, and I'm the Director of Physician and Community Engagement at the Apothecarium. We are very excited to present tonight's topic, which is medical marijuana and brain fog. And during the presentation, our speakers will discuss more about brain fog and how medical marijuana can actually help improve brain health. And why can't I advance the slide? Give me 1 minute. Thank you. Okay, so this program is brought to you by the Apothecarium. We are a full-service, award-winning medical marijuana dispensary. We have locations in Plymouth Meeting, Pennsylvania, Thorndale, Pennsylvania, as well as Lancaster, Pennsylvania. And our mission is to really provide patients with quality medical marijuana in a really welcoming environment with empathy, education, and ongoing support, which is the exact reason why we offer educational programs just like this one. So in addition to our monthly educational programs, we also offer virtual discounted certification events. So anybody who is looking to get their initial medical marijuana card or needs a renewal, we have doctors like Dr. Aggie, who we partner with twice a month to provide this service. You can learn more about our events if you need a renewal or if you have a friend or a family member who is looking to get certified in Pennsylvania. And you can go to www.apothecariumpa.com/events. We actually have a certification event this week. Dr. Aggie will be seeing patients tomorrow, and then we also have another doctor seeing patients on Saturday as well. This program is also brought to you today by Alera Healthcare, and Alera Healthcare is the growing and processing arm of the Apothecarium. Alera Healthcare creates unique medical marijuana solutions and formulations that are not only sold in the Apothecarium, but also in dispensaries throughout the state. And our mission at Alera is to improve the lives of the patient we serve, and we guide our mission. Our mission guides us in the way we grow and formulate our products. And our speakers today, I'm happy to present, are Dr. Aggie Hewitt from the Zabrecky Institute of Biomedicine, and I'll let Dr. Aggie introduce herself when I turn it over to her in just a moment. And then we have our very own Fran Markopko. She is our Director of Education and Medical Professionals at the Apothecarium, and her and Dr. Aggie are going to give you a wonderful presentation about brain fog and brain health and how medical marijuana can help. So with that said, I'm going to turn it over to Dr. Aggie to talk about a little bit about herself and the Zabrecky Institute before she gets into the meat of the program. So thank you.
Okay, great. Thank you, everyone. Good evening. Thanks for joining us. So I'm Dr. Aggie Hewitt. My background is as a critical care doctor in the ICU at Mainline Health. And I worked in critical care as well with the VA in Coatesville. What I saw in the ICU was the same people kept coming in over and over and over again. The heart failure patients, patients with lymphedema, and we weren't curing anything. We were just handing out medications that kept people alive for a period of time, but didn't improve their quality of life. So I took a different route in my training, which is more into integrative medicine and how do we use the richness of plant therapy, herbal therapy, acupuncture, other techniques that have been, preceded our medicine by thousands of years. How could I incorporate that into a practice so that patients were actually getting cured and we were actually preventing disease? And medical marijuana has become a large part of that because it is involved in the healing process and the reconstruction of many, many systems in the body. And once you're on medical marijuana, you'll, as you get more information from us in these webinars, you'll understand that you may be using it for anxiety, but it's healing your gut, it's balancing your hormones, it's doing so many things for you. So that's basically it for me. And I feel very privileged that I can be a person to introduce cannabis to the patients who need it. So brain health is fragile. We are meant to have anxiety and stress. You should have anxiety the night before a final exam. You should have anxiety if you witness a car accident. And, the response is to trigger you to move away from anything that endangers you. What's happening in our society is that we're exposed to chronic stress. So 24 hours a day, 7 days a week, there are no breaks. If you even want to take a weekend away, you've got to find an Airbnb, you've got to get airfare, do you need to be vaccinated to travel? So our lives are just a continuum of stress, which is causing a breakdown in our brains, in our ability of our brain cells to communicate with one another. So, what can actually inflame the brain? Most people know this, but it's good to go over it. Diabetes and high blood sugar. High blood sugar increases inflammation in every part of the human body. Poor circulation, lack of exercise, respiratory issues, head trauma, eating gluten when you're gluten intolerant. Gluten actually becomes like a glue in the brain. That's the best way I can explain it as to a layperson. And it prevents, again, communication between brain cells. Alcohol and drugs, environmental pollutants. We have so many studies on what Roundup and glyphosate do. Um, the leaky blood-brain barrier, that's sort of a porous wall that protects the brain. But things like Roundup can bring aluminum through the blood-brain barrier and completely bathe the brain in intoxication. It intoxicates the brain with poison. So the neurologic autoimmunity, which comes as a result of leaky gut. So there are many things that can cause brain fog. And almost all of these are initiated by stress. Almost all of these are initiated by stress. Good news, the brain is plastic. And all the studies reveal it. We've done thousands and thousands of imaging studies. So what you damage in the brain, it depends on the extent of the damage, but what gets damaged in the brain can actually be healed. That's the good news. If you damage your lung, you need a lung transplant. The lung tissue will not regrow. Liver tissue will regrow. Brain tissue regrows. So we know that we can restore health to the brain. This is a very simple anatomy of the brain. The amygdala, which is highlighted in pink, it is what generates anxiety, flight, fright, freeze, and stress causes it to enlarge. With long-term use of medical marijuana with the right strains and the right terpenes, you can actually shrink the size of the amygdala, which also shrinks and can cause extinction of traumatic memories. The hippocampus, which you see in red, is a larger organ in the brain that stores memories. So if you are finding that you're having short-term memory loss, it may be that the hippocampus is being affected by systemic inflammation, which is caused by stress. So the previous solutions in the integrative world were to, drink Red Bull, jack yourself up on caffeine, because that forced more communication between brain cells. Medications like ibuprofen, if you have a hangover, your brain doesn't feel right. We've chelated out heavy metals if you have mercury toxicity from too much fish eating, or from your fillings. There are medications that can chelate the metals out of the body. Lifestyle changes with stress reduction are huge in solutions, and I certainly, promote them today, to have some kind of a mindfulness, meditation, a relationship with nature that really reduces stress. Immune suppressing drugs were used and still are used for psoriatic arthritis, for rheumatoid arthritis, for irritable bowel diseases. They suppress the immune system so that it doesn't attack the body. And all that starts with stress. We've used ozone, IV micronutrients. They're expensive. It's hard to find integrative doctors who deliver these, and most people can't afford them. Saunas are great as a detoxification, and the infrared saunas are high on the list. But again, who has them and who can afford them? They're very expensive. Fasting is another way. When you fast, you're breaking down fat cells, and fat cells are where most of your toxins are stored. So I want to talk a little bit about how our bodies have already been programmed by, humanity is about 1 million years old. For this million years, we've developed a set of receptors in our body called CB1 and CB2 that accept the bioactive molecules of cannabis. So we've been pre-programmed as a species to accept and use cannabis in our healing treatment. And you'll see with the CB2 receptors, there are a lot of them in the gut. So when you have gut problems, when your stress is destroying your good bacteria, they're making your serotonin, your dopamine, your happy hormones. So when you're destroying your gut, those CB2 receptors are being eliminated, and you're not able to heal the gut, which is producing the happy hormones that go to the brain. You'll see that the CB1 receptors are largely located in the brain. So we know that CBD oil, for example, attaches better to the CB1 receptor. So CBD heavy dominant products are better for anxiety. CB2 is better for inflammation. And CB2 is more evenly distributed around the body. So the CB1 receptors in the brain, they regulate all these wonderful neurotransmitters: serotonin, which makes you happy; GABA, which relaxes you; dopamine, which, that's why people get addicted to cocaine. Dopamine is, the neurotransmitter that makes you feel really like you can do anything. But the most important new finding is that cannabis releases BDNF, which is brain-derived neurotrophic factor. The only way we knew to do that before was with high-intensity interval training, and many people cannot do that. We now understand that cannabis causes the release of that, which builds new brain cells. So even in stroke patients, that BDNF is critical to help restore what they lost after a stroke. So the definition of brain fog, we all have this. We can't remember things. Where did we put our keys? We get irritable with focusing on small details, some confusion, a little bit of searching for words. I'm big with the loss of sense of direction. That's part of it too. Thank God for GPSs. So the grass might be greener. This was a big study done by Stacy Groover, which showed improvements in clinical and health-related measures. It decreased the brain activation of stress, how stress activates the brain with cortisol and adrenaline, and it improved the brain activation patterns of communication between brain cells and distribution of all of your happy hormones. And she found with many studies, she did different animals and humans, that it improved the performance of all tasks. Again, Stacy Gruber worked a lot with people with brain tumors and showed that brain tumors were reduced in size with the use of cannabis. Metastasis was enormously affected by the use of cannabis, that tumors tend not to metastasize with the use of the right strains of cannabis. And in Parkinson's, it relieved tremors, ALS, MS, and even Alzheimer's. So people had better motor function because their brains were operating better. But this was a very big study for brain tumors, which we're seeing more of just from cell phone use and our exposure to electromagnetic radiation. You know, I mean, this is what really made the public hungry to understand more about cannabis, was its effect on patients who had seizures, especially children, that no medications could resolve them. And cannabis was used very effectively, and it's still used in being protective and neuroprotection of the brain. And this is you know, and it's also an antipsychotic, an antidepressant, it's an anti-anxiolytic. And the final picture that we're moving to is just a capture of a healthy brain. I thought it looked beautiful. I didn't put a marijuana leaf in there, but we will get one. I'll find the artist to put it right in the middle of the picture. But the healthy brain is not just food. It's cannabis plays a big role in keeping the brain healthy, sharp, focused, intact, and, you know, the major organ in our body to govern our daily activities.
It is a beautiful picture. Excuse me, guys. Okay, and before we get, thank you so much, Dr. Aggie, and everybody who's listening in on the call, please, you can utilize the Q&A chat to ask any questions that you may have for the doctor or for Franmar. So we'll thank you, Dr. Aggie. We'll turn it over to Franmar, and then I'm sure our participants will have some questions at the end. Thanks, Franmar.
Sure. So I just have a couple of things here. I wanted to, brain fog, you know, like Dr. Aggie said, is very much a very broad topic, but we don't have all evening. So I kind of wanted to concentrate on just more of the main aspects involving brain fog and what we see when it comes to patients in the dispensary. So a lack of focus and poor concentration. And some of these Dr. Aggie has already mentioned: lack of clarity and reduced attention span, anxiety, headaches, memory problems, insomnia, and fatigue. And cannabis, the various aspects of cannabis, which we're going to go over, the different cannabinoids and different terpenes, when you find a specific combination, it's going to help with these various aspects of brain fog. So if you are a patient, I mean, I can speak from personal experience. I have in the past suffered from chronic migraines and headaches. And when I was getting them very severely, where it was day in and day out, where I was getting a constant migraine for 4 and 5 days at a time, my short-term memory started to go. I couldn't remember basic things like brand and generic drugs, which is something that I had known for 20 years at that point. And I could not remember things. Honestly, I always say pharmacists are interesting because we know how to help other people. When it comes to ourselves, we just get completely stupid. And I went to my primary care physician. I'm like, I think I'm having Alzheimer's. I think I have the onset of Alzheimer's. I can't remember anything. This is bad. And he's like, no, it's the pain from your migraines. Your brain is concentrating so much on the pain and the fact that you're not sleeping that it's just causing this total fogginess where you cannot concentrate, you cannot remember things. So, that plays a very important role. Sleep is very important to just anything. Pain, when you're, like I said, when your body is in a lot of pain or under a lot of stress, has a lot of inflammation going on, our bodies then react, and they kind of go into survival mode where they're just kind of concentrating on the basics, and things like memory, not necessarily at the forefront when we're just our bodies are just concentrating on the basic functions that we have. So I'm going to go over next some of the cannabinoids that are going to be good in helping treat brain health. So I have, in previous talks that Dr. Aggie and I had done, I usually kind of just talk about THC and CBD. And I do have CBD down, but I have some other cannabinoids that we've yet to mention on these monthly topics, CBG and CBC. So CBD, as Dr. Aggie had mentioned, is going to be great for reducing inflammation. Two of the things that Dr. Aggie had said in her portion of the presentation over and over when it comes to mind fog is inflammation and stress. So all three of these cannabinoids are really great with reducing inflammation, which is wonderful. So along with, for CBD reducing inflammation, you're going to reduce pain that's associated with inflammation. So it's an analgesic. It reduces stress and anxiety. It reduces depression. It's neuroprotective, which is wonderful. CBG is an interesting cannabinoid because it actually hits on both the CB1 and CB2 receptors. It also decreases inflammation, which then helps decrease pain. It's an antidepressant. It helps with metabolic disorders. So for some of you that were on early when Dr. Aggie was mentioning a study with Alzheimer's, this is something that's going to help patients with Alzheimer's and Parkinson's. CBG is kind of the stem cell of the cannabinoids. It's very interesting because when the plant is growing and THC, CBD, CBC, they actually start out as CBG. As the plant continues to grow and develop, that CBG starts to transform into these other cannabinoids. So CBG is kind of at the heart of the cannabis plant, causing, everything to kind of stem off of it, which is wonderful. CBC is also, once again, anti-inflammatory. I'm kind of sticking with a nice little theme here. So it's going to help reduce with pain. So it's an analgesic. It's also an antidepressant. It actually helps stimulate brain growth, so neurogenesis. So it's going to help those damaged nerves regrow, which is wonderful, as Dr. Aggie had mentioned before, for Alzheimer's and Parkinson's and those types of medical conditions where we start to degenerate. CBC is also really good for migraines. So a lot of the things that these particular cannabinoids can do are going to help. The previous slide that I had on, going to help all of those different aspects of brain fog with patients. To kind of correlate in, we bring in the terpenes. So I selected a few terpenes. Once again, it's kind of sticking with that anti-inflammatory type of aspect. Pinene is the first one that we have listed. An anti-inflammatory, it's great for reducing anxiety. It's actually an antioxidant and neuroprotective, the effects that pinene has. It's going to be stimulating. So it's going to help with that fatigue. It's going to help increase focus and kind of help with concentration, aiding in memory. So it's going to be more of a stimulatory type of effect. I have linalool, which is next, from lavender. Also anti-inflammatory benefits, which is going to then also help as a pain reducer. It's going to help as a muscle relaxer too. So when it comes to stress and anxiety, it's going to help those aspects. It's going to help with pain as well. So whether you have muscle tightness and spasms that you're just kind of clenching up all over, or you're just really stressed out from things that have been happening, the chronic stress, this is going to help relax some of that. So if you're relaxed and we're reducing inflammation, it's going to then also help with the brain fog. Bisabolol from chamomile tea, also very relaxing, has anti-inflammatory properties, which then in turn, once again, analgesic properties to help with pain. And it's also going to help reduce that stress and anxiety that we go through every day chronically. Ocimene, not a very common terpene, but you will find it sometimes in very nice percentages in some products in the dispensary, which is great. Anti-inflammatory properties. It actually has some antifungal and antiviral as well. And it works best when it's combined with other terpenes. It kind of helps elevate itself with its anti-inflammatory properties, and it helps the other terpenes that it's paired with to also kind of elevate their game. Once again, we kind of pull in that whole term, the entourage effect. One kind of helps boost the other one, do even more, which is great. Caryophyllene. This is kind of probably the most popular, aside from myrcene, one of the most popular terpenes because it has huge anti-inflammatory properties. Also then helps with pain. So it's an analgesic. It helps reduce anxiety as well. Caryophyllene is probably even a little bit better than the ocimene when it comes to enhancing the effects of other terpenes. Caryophyllene by itself is kind of neutral, but if it's paired with some stimulating terpene, like maybe pinene, it's going to help elevate that pinene a little bit more and kind of give it a little even better kick in the pants to be more stimulating. So it's going to help, even more with that fatigue and that concentration aspect and that energy. If caryophyllene is paired with maybe another terpene that's maybe a little bit more relaxing or sedating, like linalool, it's going to enhance those effects. So it's going to enhance the effects of linalool when it comes to relaxation and pain and stress reduction. So you kind of get the best of both worlds with a little extra kick into it for nothing else, which is great. So the combination of various cannabinoids and terpenes for whatever you're particularly looking for is going to be beneficial in treating the different aspects of the brain fog. And then we come to the various long-acting and short-acting types of form of consumption. Usually when it comes to a good portion of how we want to treat various medical conditions, a lot of patients have more an immediate need. So if they're having more kind of anxiety attacks, they need something that's fast acting. If they're having more of a faster onset of pain, they need something that's fast acting. But when it comes to brain fog, we need to consider, having something that's going to be long acting, more maintenance, because we want longer coverage throughout the day. We don't want to have to be doing something short acting, every couple of hours. So the first one I have is maintenance. So the long acting form. So this is where your capsules and your tablets and your solutions and your RSO, your Rick Simpson oil and your distillate syringes come in because they can be taken orally. So they're going to have a longer onset, maybe 30 minutes to 2 hours, but the effects once these maintenance medications kick in are going to be 6 to 8 hours. So it'll be, be really great when you need that stimulation or you need to have more of a longer acting type of medication to take a capsule or a tablet. At the same time, we have issues where we need more of a short acting medication. This is where the inhaled products come in. So your flower, your vape cartridges, your non-activated concentrates are going to come in, and they're going to have a really quick onset, usually 1 to 10 minutes, but they're kind of short-lived. The effects are only going to last anywhere from like 2 to 2.5 hours. Tinctures are a great alternative for those patients that don't want to do anything inhaled. We're still in primetime COVID season for this past year, and a lot of patients want to have an alternative and, you know, protect their lung health. So tinctures is a great option because it's a product that doesn't have to be inhaled. It's absorbed sublingually under the tongue, which is great. Onset usually is around 15 to 30 minutes, and then the effects are going to be about 3 to 4 hours. Pairing short-acting with long-acting forms of consumption works really well. As pharmacists, we tend to actually gravitate more towards the tinctures and the solutions. The reason being is a tincture is a solution and a solution is a tincture. So you can use one product two ways. You can use it under the tongue, so it has more of a fast-acting effect. You can then swallow that same product and it's a long-acting effect, which is great. So you kind of get a two for the price of one deal, which is very nice because sometimes treatment plans can get a little bit expensive in this industry. So when you have something like that, that's great. We also will utilize those tinctures and solutions at lower doses. You know, they'll have one effect during the day. At higher doses, they'll be a little bit more sedating, so better for a sleep aid. So then here's a product that you can use short acting, long acting during the day and at night. So we have a nice, you know, one product that can be used not only a variety of ways, but throughout the day into the evening, just based on the dosing situation. Once again, always when you have questions, whether it's about drug interactions or what you should be taking based on your needs, there's always a pharmacist available at our dispensaries. You know, please call, set up an appointment. We would do virtual, we do in person, ask a question so you can kind of fine tune what's going on. We always say patients, you know, will come in and they'll say they have a quick question, but the answer is not necessarily a quick answer because normally we have to have a couple follow-up questions in order to get to what's really going to be a good recommendation and a suggestion for you. So with that, that kind of concludes our presentation. So I see we do have some questions.
Yes, we do. I see 3 questions up here.
We want to start at the top?
Sure. Do you have access to them, Franmar?
Yes, I pulled them up.
Okay, perfect.
So a tincture recommendation for sleep. Any studies on sleep and cannabis and brain fog? So tinctures for sleep. So it's very interesting. You'll see in the dispensary some products, you know, some tinctures are going to be labeled more indica. Those are going to be great for sleep. They're going to have usually specific terpene profiles that are geared more towards relaxation and sedation. It is very interesting though, you can use hybrid tinctures for sleep. The reason being is a side effect of too much THC is drowsiness. You'll also see this in prescription medications. You'll have some prescription medications out there. Benadryl is a great over-the-counter medication because, you know, patients will utilize it for sleep. It wasn't indicated for sleep, but the side effect profile causes drowsiness. So people use it as a sleep aid. So it's the same kind of thing with some of your tinctures. At a slightly higher dose than maybe what you would take during the day, you can take a slightly higher dose at night and you utilize that side effect of the THC as a sleep aid for sleep. So things to look for are, you know, THC for the tincture. Specific terpenes are going to be your myrcene, your linalool, and your bisabolol are going to be the most relaxing and sedating terpenes for that. So studies, then it's a two-parter, studies on sleep and cannabis and brain fog. All 3 together, I don't believe there's any study on that. I could be definitely wrong because I don't know every study that is out there, but sleep and cannabis, there have been, I believe there have been studies on that. And yeah, we know that cannabis works for sleep. That's actually probably one of most patients' goals, regardless of their medical condition, is a goal that they would like to treat when they come into the dispensary is sleep, because none of us, I don't think, ever get enough sleep. I know I do not. And the daylight savings time with my animals is a prime example. Dr. Aggie, did you want to add anything to that question at all?
You know, the studies are ongoing, and the Pennsylvania lawmakers have a difficulty with approving insomnia as a condition for medical marijuana use, because some people don't sleep because they drink tons of caffeine. Some people don't sleep because they have a bad mattress. So, you know, they're still trying to work out, how do you distinguish the person who actually could benefit from medical marijuana in insomnia, and for what other people is it just there might be another simpler solution. And I think the doctor really has to make a call. A lot of people have insomnia because they have sleep apnea that's never been diagnosed. So there is a little bit of a workup that I would do for insomnia to rule certain things out, but there are tons of studies, and you can go to Google Scholar and look at some of them. There are many, many studies on sleep and cannabis. Some people are very sensitive to THC. They do better with, you know, indica dominant and CBD dominant products. And again, that's completely individually determined. It's all genetically pre-programmed how you're going to react to THC.
Thank you.
So I will take the next question.
Okay.
I found dermal patches very effective. Why are they no longer available in Pennsylvania? So the transdermal patches were actually produced by a grower processor called Cresco. They are no longer available. I don't believe that they were necessarily very cost effective. And I think a lot of dispensaries really didn't know how to educate patients properly on this sort of aspect of a form of consumption that was available. So I think for that reason, just because it wasn't doing so good in the dispensary selling, Cresco decided to discontinue it. I don't know from their end if it was, you know, maybe producing it wasn't always cost effective as well. There is a transdermal topical product, so you can use it very similar to how you use the patch. That is by a company called GTI, and it's Dr. Solomon's lotion. So that is a transdermal product. So it actually contains 3 specific ingredients in that product that will take that THC, and they make a THC CBD combination lotion, and will take those cannabinoids into the bloodstream. So you will have the same effect as you did with the dermal patch. So that's an alternative for you. Just start low and go slow, just so you don't, you know, have too much going into the bloodstream and you don't get, you know, you go kind of too far and you don't get the effects that you want. You get something that you didn't want. So try, you know, but that's an alternative to the patch.
Okay. Thank you,
Okay.
Caroline. The next question was for Dr. Aggie. A gentleman says that his mother suffered from a severe stroke about 3 years ago and has aphasia and very limited function on the right side of her body. So if they were to introduce cannabinoids to her now, 3 years later, would they still have a positive effect on neuroplasticity and brain regeneration? It's a really good question.
Yeah, it's a great question, and it absolutely it is never too late to start healing the brain. I'm assuming she suffered a left-sided stroke because the language area in the brain is called the Broca's language area, and that's on the left side of the brain, which means the right side of her body would have been affected, and her ability to speak and understand language. But these cannabinoids are very powerful. Understand that nerve cells are the slowest cells in the body to grow. Your red blood cells regenerate every 3 months. Liver cells regenerate. Skin cells are the most rapidly regenerating cells. Nerve cells are slow to regenerate, but absolutely introduce her to cannabis. Absolutely. The brain, it is amazing what the brain can do with a jump start like a cannabinoid. And the pharmacist would help you choose the right combination of CBD and THC for her, the right terpenes. But this brain is plastic. She injured part of it died, by either a hemorrhage or an embolic event. But there are new brain cells that can be built. And what I said earlier, that cannabis generates BDNF, that is the key chemical in the body that triggers the stimulation of building new brain cells. It works with stem cells to basically build new brain cells. So absolutely, I would have your mom on it. But you want to be careful about the ratios and make sure you run that by your pharmacist.
Mhm. Yes, and of course your mother's physician as well. It's always good to let the physician know, even if that's not the physician who's recommending the medical marijuana.
Right.
Mhm. Lynn asked, is this being recorded to review? Yes, yes, it is. All of the webinars that we do on a monthly basis are recorded and then edited a little bit because we have some like lag time in the beginning, and then we compile all of the questions that were also asked and post those. And they're posted to our website, and we do email them out to all of the participants that were on the original call, as well as it'll go out in like our email blast. If you receive those, that's probably how you learned about this event. So yeah. And I believe you asked, are the slides available to study? So the slides will be available once we post it to our website. So thank you. Another question, health may be restored in brain. How about neuropathy, knowing nerves do not regenerate?
I'll jump in on that one. Neuropathy is actually one of the conditions for which you can get medical marijuana. It is a qualifying condition, and nerves do regenerate, but very slowly. And it depends entirely on what is causing this. Is this a peripheral neuropathy? Is it a neuropathy in the face? Is it a neuropathy due to diabetes? You have to understand that what's killing the nerves, especially in diabetics, I'll focus on that, is inflammation. The inflammation caused by high blood sugar. So when that's brought under control, and the different compounds, the bioactive compounds in cannabis can restore health to the nerves, reduce the pain because they're reducing the inflammation. So nerves can regrow. They can regrow, but they're very slow to regrow. In the meantime, people use cannabis for neuropathy because it basically can eliminate the inflammation, and the inflammation then will allow the nerve some breathing room to start to regenerate itself. It's when the nerve is continually bathed in inflammation that it will not regenerate. So the more you can do as an anti-inflammatory, not the pharmaceutical stuff, because you've got all the side effects, like with ibuprofen or diclofenac. You've got a lot of side effects. You don't have that with the cannabis. So you want to get, again, the right combination. And neuropathy is a qualifying condition for medical marijuana because it responds so well to cannabis.
Okay, thank you. Let's see, there's a few others. How do you marry CBD and THC to complement each other?
So it's kind of going to depend on the patient and what we are trying to treat, what your goals are, as opposed to, what level of THC and CBD product we might recommend. They do complement each other. I mentioned the whole entourage effect. When you start taking aspects of the cannabis plant and stripping it down to, just all THC, no other cannabinoids, no terpenes, no anything, you lose how it's going to work when it works together. It's the same thing when they started, kind of breeding high CBD cannabis plants, and then you end up down the line producing hemp that just contains that CBD. It doesn't have the THC or other cannabinoids or other terpenes associated with it. You need all aspects working and playing together. They elevate, they build off of one another. That's the whole aspect of the plant. That's why Mother Nature is so gifted in how she produces things. It's when we as humans start messing around with it and trying to synthesize it and do everything else with it to commercialize it, where we lose the true identity of the plant and what it's supposed to do. So it's just a matter of what you're looking to do with some of your goals as to what levels of THC and or CBD we would recommend. CBD is interesting. I don't know if some of you know this. So CBD is what they call biphasic. At lower doses in patients, it tends to be stimulating. At higher doses in patients, it tends to be sedating. The question is, we don't know, because everybody's an individual, at what dose is it stimulating, and then at what higher dose does it become sedating? And that's kind of the mystery. So you'll have patients that say, oh, I can't do CBD, I'm too stimulated. Then we have other patients that, 5-10 milligrams of CBD, and they sleep great all night long. It's just a great sedative for them because their line is closer, down the lower end. Other patients, they might need 150 milligrams of CBD for it to have that sedative effect, because everybody's different. So it just depends on the patient and what your goals are.
And anybody at any time can come into our dispensary and sit with, it's not only on your first visit that you can sit with a pharmacist, you can sit with a pharmacist on every visit to go over, some of these things as well. So don't ever be afraid to ask to see the pharmacist.
Yeah.
One of the participants asked here that they had a massive brain injury when they were 22 years old. What would you recommend to rebuild brain cells? Are there certain cannabinoids that are most helpful in helping build back those brain cells?
CBG and CBC, two of the ones that I went over, have been shown in some studies to be help with neurogenesis and are neuroprotective. So they're going to help, some of that move forward. As Dr. Aggie said, a lot of issues happen in our bodies. Inflammation. The inflammation is our body's response to some sort of outside negative stimuli. It's a normal response. The problem is we all have it for one reason or another, whether it's diabetes, neuropathy, whatever is going on in our body. That's our body's natural way of which to protect itself. So we have to constantly have that inflammation aspect under control. So once you kind of have things in a better place, the body has a better chance of starting to heal itself.
Thank you, Franmar. We have one more question, and we also have, actually we have two more questions. They keep coming in, but somebody also said that this presentation is beyond informative. So thank you, Diana.
Thank you.
Appreciate that.
Thank you.
I love this question. Can you take too much medical marijuana?
Do you want to take this, Dr. Aggie, or you want me to?
Well, I mean, I'm going to punt the ball to you because every single human being reacts differently to every molecule in the medical marijuana plant. Some people can eat tons of sugar, they never get diabetes. Other people can eat small amounts. We are actually looking in medicine at the genome, at your chromosomes, and we will be able to tell you within 5 years what foods you should be eating. Are you carb intolerant? Like a lot of vegans really need higher protein. So right now, a nutritionist can do the best that she can do, but until we understand your individual genome and what you can and can't, metabolize, there's going to be a gray zone. I'm going to punt this to Franmar because I think that I don't think you can take too much CBD. You can take too much THC if you're anxiety prone. But again, there's an entourage effect. She'll talk more about this. You cannot overdose on medical marijuana because there are no receptors in the brainstem for cannabis. So it can't shut your breathing or heart rate down. So your breathing is protected in the brainstem because you have no receptors for cannabis there. But let me let Franmar take over.
Yeah, so you cannot die from taking too much cannabis. However, can you kind of have, some undue side effects if you take too much cannabis? Yes. That can happen with THC, that can happen with CBD as well. Side effects can include anywhere from anxiety to paranoia. Too much CBD can possibly cause diarrhea. So there is too much of a good thing, I guess you can say. And depending how your body is going to react to too much of a good thing, whether it's just going to be dry mouth, or you're going to feel paranoid, or you're going to get diarrhea. There is potential side effects when it comes to cannabis. As pharmacists, we try to instill in patients, start low and go slow. You can always add more, but you can't take out what's already in you. We always look for what we call the sweet spot. Too little medication doesn't work. Too much causes side effects. We want you to have a good experience and kind of be in that sweet spot. But it's always a dose discovery process when it comes to patients trying to find how much is enough, how much is going to be, or how much is too much. So, like I said, too little is not going to work. Too much is going to cause some side effects. So we kind of like to stick to that middle realm. But yeah, it is possible to take, too much cannabis for you and how your body's going to react to that. And once again, that dose for you that's too much might be a perfectly normal sweet spot dose for somebody else. And that's the interesting part of this plant, is because it's so individualized based on our endocannabinoid systems, how many receptors we have and where they're all located, because they're different for each individual. So each treatment plan is individualized for each patient, because we're all different, which is wonderful.
Yeah, and I just wanted to add for new users too, that it can be like trying on shoes. You may go through 5 pairs before you find the one that's actually your sweet spot. So why it's really critical to work with the pharmacist, for what you may like or may want more of. Work with your pharmacist. Allow them to prescribe the proper dosing and route of delivery for you, so that you can hit that sweet spot, because every single human being metabolizes these cannabinoids differently. So it's really critical to work with your pharmacist.
Absolutely. And we'll take one last question, and then we're almost at time. Last question, if a patient buys flower and decarbs it themselves into a tincture, how would they go about determining their dosage, like the dose of what they're utilizing?
So you have to kind of conjure up your middle school algebra brain for all of this, because you're going to have to do some math. So,
and our pharmacist can help you do that math.
Yeah, you're going to probably have to ask one of the pharmacists to help you do that math, for the simple reason we'll have to know a couple of determining factors. So what was the percentage of flower THC? Was it a 20% strain? Was it a 26% strain? Was it 13? We have to figure that out first. And we have to figure out how much you're decarbing. Did you just get a gram? Did you get an eighth? Did you get a quarter? So we need to know the quantity of that. And then when it comes to, we would figure out then, once you decarb it, how many milligrams of THC then is going to be in that decarbed flower. And then the tincture volume that you're going to use. So I'm going to assume you're going to put it in some sort of fat type of tincture base. Coconut oil is probably going to work well. Olive oil is going to work well. So we have to determine how much volume that you're using, so then we can kind of figure out the dose of how many milligrams of THC or CBD, whatever that flower was, to half a dropper full dropper full. So we have to kind of, yeah, conjure our inner junior high algebra days. And, you know, if you thought you were never going to use math again, here it is.
And we have a lot of patients who do that whole, you know, decarboxylation
And
process.
make it, yeah, into tinctures, topicals, they'll make
Gummies.
their own gummies. Yes.
Mhm.
So
Candies.
yeah, because flower is the most cost-effective form of consumption that is available, and it doesn't just have to be inhaled. That's, you know, kind of a myth. You can, if you're willing to take the time and learn how to do it, you can make a lot of different products and save yourself a lot of money by doing a lot of do-it-yourself at home.
Yeah, and maybe that could be topics for future education.
Oh, that would be fun.
Yeah, and we've always talked about doing like a cooking class, but I think that might be a really good topic. So,
So Lynn,
cool.
good question. We just inspired new topics. So
Bring Martha Stewart on board.
So we are at 3 minutes to 8. So I just wanted to thank everybody again for joining us this evening. Thank you to our speakers, Dr. Aggie and Franmar. And next month, our topic is medical marijuana and autism, because it is Autism Awareness Month. So if you know anyone who would be interested in that, you know, tell them to keep an eye out for our emails. But thank you very much. And again, this will be recorded and posted onto our website with all of the questions. And you can certainly contact us at the Apothecarium if you have any additional questions. Okay. So have a great night, everyone. Thank you again.
Bye, everyone. Thank you for participating.